Welcome to the Explainer. We're going to start today with just one number, a number that reveals one of the deepest, most significant divides on our entire planet, the gap between the world's developed and developing regions.
15 to 20 years. Just let that sink in for a second. That is the gap in life expectancy depending on where you happen to be born. It's a staggering difference that tells the story of two profoundly different worlds existing on the same planet.
So the big question is, why? Why does this happen? What are the fundamental factors that create a reality where your birthplace can so dramatically predict how long you'll live? To figure that out, we've got to understand what truly separates these two worlds.
Okay, so first things first, let's look at the most basic difference of all, health. These stark contrasts in health outcomes are right at the very heart of this global divide.
You see, this health gap isn't just about how long you live. It's about the very start of life itself, with much, much higher infant and child mortality rates in developing nations. And it's also about what people get sick from. As we're about to see, the most common diseases in each region tell you almost everything you need to know.
So what do we actually mean when we throw around terms like developed or developing? Well, these aren't just labels. They really get at a society's core ability to provide for its people. At its core, development is really about whether a society can meet these fundamental human needs. Does a country have the systems, the infrastructure, and the economic stability to give its citizens the basics? We're talking about a roof over their heads, enough food to eat, decent healthcare, an education, and a chance to find work. This is the foundation that everything else is built on. Now, let's see how this all plays out in people's daily lives, because the economic and social fabric of these regions, well, they couldn't be more different.
Just look at the contrast here. On one side, you've got economies largely built on agriculture, where most people live in rural areas and the average income might be as low as $2,000 a year. And on the other, you have these industrialized, urban societies where 8 out of 10 people live in cities and the average income can be over $40,000. That massive economic gap, it's the engine that drives almost every other difference.
And that economic divide translates directly into quality of life. Access to knowledge is a perfect example. In some of the least developed countries, adult literacy can be as low as 63%. Meanwhile, it's pretty much universal in developed nations. And that one single factor affects everything, from how technology is used to the quality of roads and communication, all of which shapes the overall standard of living.
But these differences in money and infrastructure also shape the populations themselves. The very age structure of these two worlds tells a huge part of the story.
Okay, check this out. In the least developed countries, a staggering 41% of the population is under the age of 15. This creates what's called a population pyramid. It's really wide at the bottom with all the young people and gets very narrow at the top. Now contrast that with developed countries. The structure is totally different. Here, only about 16% of the population is under 15, while 18% is over 65. So it's not a pyramid at all, it's much more like a pillar, with a way more even age distribution. And these two different shapes create completely different pressures on society. In developing nations, the challenge is enormous. How do you educate and provide for this huge youth population? It strains all of the national resources. In developed nations, the challenge is different. How do you support a large and growing elderly population? It puts immense pressure on pensions and healthcare systems. So, with such a vast divide separating these two worlds, what's the path forward? What does the future of global health even look like?
Well, the challenge is actually getting more complex. Developing nations are now facing what's known as a double burden. They're still fighting infectious diseases like malaria and TB, but now they're also seeing a huge rise in chronic diseases like heart disease and cancer, the very illnesses we've historically associated with the developed world. It's like they're fighting a war on two fronts.
And this is where that double burden becomes a crushing reality. 2.5 billion people around the world live on less than $2 a day. For them, the incredibly high cost of long-term treatments for something like diabetes or cancer, it isn't just a burden, it's an impossibility. It's something that can push an entire family even deeper into poverty.
So what's the solution? Well, the World Health Organization has a pretty clear roadmap. And it starts with the absolute basics, like reducing mortality for mothers and their children, because healthy families are the bedrock of any healthy society. Then, you move to controlling major infectious diseases, which frees up resources, and you promote healthy living to fight that rising tide of chronic illness. But the end goal, the big one, is that fifth point, making sure everyone, everywhere has access to essential care.
But here's the final and maybe the most crucial piece of the whole puzzle. Health doesn't exist in a vacuum. You can't achieve these health goals without making progress in all these other areas. It means tackling poverty and hunger. It means providing education for all, empowering women, and protecting our environment. And ultimately, none of it happens without political will and real global cooperation.
Which brings us to our final question. Is a world where your birthplace doesn't determine your lifespan actually possible? The tools, the technology, the knowledge, it all exists. But the answer, it seems, depends less on some new wonder drug and more on our shared global commitment to building a more equitable foundation for every single person.